So in your opinion, talking specifically about heart health, how important is sport and exercise to heart health?
Well, clearly heart disease is one of the biggest issues we face in the United Kingdom, and sport and exercise is a very obvious way that we could tackle that health problem long term. A lot of time and effort has been spent in reducing incidence of smoking, trying to get people to reduce calorie content of diet, trying to reduce the obesity epidemic. Perhaps now, though, time is more to emphasise the work that's been produced in any number of countries to show that exercise is good for a healthy heart, and that all adults should be participating in some form of activity for at least 30 minutes a day, 5 days a week. And we know at that level of exercise, your heart will become far more healthy, because the muscle will become trained to pump more efficiently the amount of blood you need around the heart. So you effectively reduce the rate at which your heart pumps, make the muscles more efficient and put less strain on the heart overall, and therefore make it healthier. Well, obviously, gym-based exercise isn't for everyone. The first thing we can do is, if we have no history of illness, is we can start walking more. We can take the stairs instead of lift. We can park that little bit further away from work, and we can make sure that we have 30 minutes of walking every day. Having a dog at home, walking it for 15 minutes twice a day, but going out for a purposeful walk rather than a stroll. Doesn't have to be jogging, doesn't have to make you out of breath. It's just activity. First of all, that's good enough to start with. I think if your requirements are higher, that you wish to exercise more, then activities such as gym-based work or light jogging or even dancing, you can see from television shows the significant effect that regular exercise in the form of even ballroom dancing changes people's figures and makes them a lot more positive about themselves, and certainly will have an effect of increasing their heart health. Beyond that, I think if you had a problem like heart disease, or you're very overweight or diabetic, or perhaps over 40, it's always advisable just to check with your general practitioner that there isn't a specific reason you shouldn't be active. A lot of people who've been ill with either cardio or respiratory problems get quite frightened about being short of breath, and yet, when you're a 20-year-old, you don't mind being short of breath. That's how you get fitter. So it's about encouraging people of all ages to do more activity, and even in the elderly, exercises such as Tai Chi. The older population, this is still a very valid form of exercise for them, with all sorts of benefits. I think that's true already. I think you can look at different practices within different areas, and certainly in Mumbles, I think we've got quite a good exercising population, and even though we've got an older population, our incidence of heart disease is less than perhaps in some of the urban areas where people traditionally have been less active, maybe more manual work, but maybe less active in their other day-to-day activities.